Washington Dulles International Airport, July 20th, 2026. A federal aircraft touches down after a flight that began thousands of miles away, in a country in the Middle East. On board in restraints sits a 54-year-old man named Khalid Ahmed Satari.
Just hours earlier, he had been walking through a foreign airport carrying a passport that wasn't his, a counterfeit Mexican passport, issued under a completely different identity. For more than 3 years, he had vanished. Government searched. Investigators followed dead ends. And then, in less than a month, he was found.
This is the story of how a man accused of stealing more than $500 million from America's most vulnerable citizens ran, and how in the end, he didn't get away with it. To understand how this began, you have to go back to 2016. Prosecutors say Khalid Satari owned and operated a network of diagnostic testing laboratories.
On paper, these labs offered a legitimate and increasingly common medical service: genetic testing that could detect a person's hereditary risk for certain cancers. But according to federal investigators, that's not what was happening here. Medicare, the government health insurance program covering roughly 65 million elderly and disabled Americans, reimburses laboratories for legitimate medical testing.
For this specific kind of cancer genetic test, the reimbursement rate authorities say was extraordinary, between $10,000 and $20,000 per sample. Prosecutors allege Satari understood exactly what that number meant: Tenjin Peak.
To turn that opportunity into hundreds of millions of dollars, authorities say Satari built a network of dozens of co-conspirators. Patient recruiters who canvassed senior communities, telemarketing call centers promising free genetic health screenings, and telemedicine companies that authorized tests without properly examining the patients receiving them. The pitch, prosecutors say, was simple and deceptively caring.
A phone call, a friendly voice. This test could save your life. It's free. It's covered by Medicare. For many elderly Americans, that sounded less like a scam and more like a kindness. Investigators allege doctors were paid illegal kickbacks to sign off on these orders, and patient recruiters were paid bribes for every new lead.
Between 2016 and 2019 alone, authorities allege this scheme funneled more than $547 million out of the Medicare program. In September 2019, the operation caught up with him. Satari was indicted by a federal grand jury in the Eastern District of Louisiana. Federal agents seized 16 bank accounts and restrained real estate holdings. It looked like the beginning of the end. Tenjin Peak.
But despite objections from prosecutors, a judge released Satari on bond, barred, as a condition of release from working in the healthcare industry. According to prosecutors, he didn't stop. Investigators allege that while out on bond, awaiting trial, he quietly began conspiring with laboratories in the Houston area to continue submitting fraudulent claims.
A federal judge determined Satari had violated his release terms, and in late 2022 issued a new arrest warrant. Satari never appeared in court. Investigators believe he fled the country. For the next 3 years, he effectively disappeared. No confirmed sightings. Just an open federal warrant waiting. Tenjin Peak. Then in the summer of 2026, something changed.
The White House Task Force to Eliminate Fraud, chaired by Vice President J.D. Vance, partnered with the FBI on a new initiative. On June 4th, FBI Director Kash Patel announced the creation of the Most Wanted Fraudsters list, targeting the architects of massive financial crimes against everyday Americans and government programs. The list wasted no time.
Its first name, Herb Kimball, accused of a $1.2 billion fraud scheme, was captured in the Philippines just 4 days after the list launched. 15 days later, on June 23rd, a second name was added: Khalid Ahmed Satari. The FBI publicized a reward of up to $150,000 for information leading to his capture. Less than a month later, the search ended.
On July 20th,
Regional law enforcement partners in the Middle East located and apprehended Sateri, still carrying that counterfeit Mexican passport built around a fabricated identity. It very nearly worked for over 3 years. It didn't work forever. He was transferred into U.S. federal custody and flown back to American soil.
Acting Attorney General Todd Blanche said the defendant had orchestrated a massive fraud scheme that preyed on thousands of elderly patients, deceiving them into undergoing expensive, unnecessary tests and fraudulently billing the government for more than $500 million.
FBI Director Kash Patel called it the third most wanted fraudster capture from the FBI, and its partners in just 5 weeks. An unusually fast pace for a category of crime that has historically let fugitives simply outlast the system. Tension peak. It's worth pausing here on something important. Khalid Satari has been arrested and charged. He has not been convicted.
He is presumed innocent unless and until prosecutors prove their case in court. What we know for certain is what's in the public record: the original 2019 indictment, the seized assets, the violated bond conditions, the 2022 warrant, and now the 2026 arrest.
But regardless of the final verdict, this case already shows how fraud against public programs actually works. Quietly, patiently, hiding behind legitimate-sounding medical language, and preying specifically on people who trust the system to protect them. Elderly Americans on Medicare are, by definition, among the most vulnerable participants in the healthcare system.
Fraud like this doesn't just cost taxpayers money. It exposes real patients to unnecessary tests, unnecessary anxiety, and a healthcare system quietly being bled from the inside. What makes this story different is the ending. At least, the ending so far. 2 captures in 5 weeks, spanning 2 continents, suggests this isn't a one-time headline.
It's the start of a pattern law enforcement wants every fraud fugitive still hiding somewhere in the world to notice. Khalid Satari now faces the charges waiting for him since 2019, along with whatever additional charges stem from his years on the run. His case moves through the federal court system from here, like any other American defendant.
What's already clear based on the public record is this: for 3.5 years, a fake passport and a foreign country bought him time. It didn't buy him forever. If this story kept you hooked, hit like and subscribe for more real document-based investigations like this one.